Do something right now. Swallow once, just once, and pay attention to what you feel at the back of your throat. Is something sitting there? A thickness, a coating that will not go away no matter how many times you clear your throat this morning. A sensation so familiar you have stopped noticing it consciously, the way you stop noticing the sound of a clock ticking after it has been in the room long enough. Now think about this honestly. How many times have you cleared your throat today already? How many times yesterday? If I asked you exactly when this started, when this persistent heaviness and coating first appeared, could you give me a specific date? Or has it simply been there so gradually, so quietly that you cannot clearly remember life without it? Here's what I need you to understand before we go any further. That mucus is not random. Your body does not produce persistent symptoms without reason. Every chronic symptom is your body communicating something specific, something it needs you to understand and address. The question is whether you have been given the information needed to actually listen. And in my experience working in preventive health and senior wellness, this particular symptom, persistent throat mucus, is misunderstood and mismanaged more consistently than almost any other complaint I see in adults over 55. People are handed lozenges, they are told to drink more water, they are dismissed at appointments with explanations that do not actually explain anything. And the real cause, sitting quietly underneath everything, never gets identified or addressed. Today, that changes. I am going to walk you through 5 specific research supported causes of persistent throat mucus in adults over 55. And I am going to do something that most discussions of this topic never do. I am going to tell you which 2 of these causes are almost certainly operating together in your body right now, because they almost always are, and exactly how that combination makes everything dramatically worse than either cause would produce alone. Before we begin, I want you to do one thing. In your mind, answer this question. Is your throat mucus worst first thing in the morning, or does it stay with you throughout the entire day? That single question tells me a great deal about which of the 5 causes is likely the primary driver for you. Hold that answer in mind as we go through each one. Let us start with the biology because most people have never been told this, and it changes everything about how you understand this problem. Your body produces mucus every single day, every single hour without pause. This is completely normal and completely healthy. Mucus is your body's protective coating for your airways. It catches bacteria, dust, and viruses before they can settle deeper into your lungs. It keeps the delicate tissue lining your throat moist, resilient, and functional. Without mucus, your airways would dry out and become vulnerable to every pathogen you encounter. Mucus is not the problem. The problem is what happens to mucus as we age. Your airways are lined with millions of microscopic hair like structures called cilia. Their job, performed millions of times daily without any conscious awareness on your part, is to sweep mucus upward and outward, keeping it thin, mobile, and clearing continuously so it never accumulates. In a younger adult, this mucociliary clearance system is efficient and fast. Mucus is produced and cleared almost instantly. But research has confirmed clearly that as we age, these cilia slow down. They beat less frequently. The result is that mucus, which would have been swept clear in seconds at age 40, can pool and accumulate for hours at age 65 or 70. What this means practically is that any factor pushing your body toward excess mucus production will hit harder and last longer in an older adult than in a younger person. That is not a complaint about aging, it is simply the physiology, and understanding it is the foundation of everything that follows. The first cause is the one I want you to pay the most careful attention to because research consistently shows it is the most frequently missed explanation for persistent throat mucus in this age group. It is called laryngopharyngeal reflux. You may never have heard that term. Let me give it to you in plain language. Most people are familiar with heartburn, that burning sensation in the chest after a heavy meal, the classic presentation of acid reflux. But there is a quieter, more deceptive version of this same problem, one with no chest burning whatsoever, no obvious digestive discomfort, no clue pointing toward the stomach, just a throat that will not settle down. Here is what is happening. At the junction where your esophagus meets your stomach, there is a muscular ring called a lower esophageal sphincter. Its only job is to stay closed after you eat, keeping stomach acid locked away where it belongs. As we age, this valve gradually loses tone, like a rubber band that has been stretched too many times over too many years. When the valve does not close completely, stomach acid moves upward, not just into the esophagus, but all the way into the throat, the voice box, and sometimes even the nasal passages. Now, here is the detail that makes this so significant. The tissues of your throat are not designed to handle acid the way your esophagus is. Your esophagus has some protective capacity. Your throat has essentially none. Even the smallest trace of acid reaching throat tissue triggers an immediate protective biological response. Your body rushes to produce thick mucus to coat and protect that irritated tissue. This is completely logical biology. But when this is happening night after night while you sleep, the result is that you wake up every single morning to that familiar heaviness at the back of your throat with no idea why, because there has been no chest burning, no heartburn, no symptom pointing you toward your stomach at all. Research published in clinical ear, nose, and throat literature shows that up to half of people with this condition report no heartburn whatsoever, just chronic throat clearing, a voice that sounds rough or different in the mornings, and mucus that begins accumulating the moment they wake up and often persists for hours. Ask yourself honestly, is your throat significantly worse in the morning than it is later in the day? Does the sensation worsen when you bend forward to pick something up or tie your shoes? Has your voice sounded hoarse or different when you first wake up? These are the recognizable patterns of silent reflux. And when we reach the action plan at the end of this, I am going to give you specific steps that can begin making a difference as soon as tonight. One important clinical note worth your attention: if you regularly take anti inflammatory medications for joint pain, ibuprofen or naproxen being the most common examples, peer reviewed research has established clearly that this class of medications reduces the body's natural protective mechanisms for the stomach lining. That makes acid reflux, including the silent variety that reaches the throat without producing chest symptoms, significantly more likely to occur or to worsen over time. If you take these medications regularly and your throat has been persistently troubled, please bring that specific connection to your physician's attention at your next appointment. The second cause tends to arrive quietly and go unrecognized for exactly that reason. When people think of sinus problems, they imagine the dramatic version: intense facial pressure, throbbing pain across the forehead, nose completely blocked, the unmistakable picture of a sinus infection. But in many adults over 55, chronic sinus inflammation presents almost invisibly. Breathing feels mostly normal. There is no significant headache, no dramatic nasal congestion, and yet the sinuses, mildly swollen and producing slightly more mucus than they should, are draining steadily and silently down the back of the throat throughout the entire day. This is postnasal drip, and published research confirmed that the average age of patients presenting with it clusters precisely around 55. It is not coincidental that this is your age group. The physiological changes of this decade of life, including shifts in mucosal tissue tone, changes in immune response patterns, and the slowing of ciliary clearance we discussed earlier, create exactly the conditions under which this kind of invisible, low grade sinus drainage becomes persistent. The frustrating aspect of this cause is that many people dealing with it have already spent months taking antihistamines from the pharmacy, assuming the explanation must be seasonal allergies. And there is a specific reason that strategy consistently disappoints. Antihistamines dry the mucus temporarily, but they address none of the underlying inflammation inside the sinuses that is driving the excess production in the first place. Dried, thickened mucus stuck at the back of your throat is often more uncomfortable and more difficult to clear than the original problem was. The approach with the most consistent research support for this cause is something remarkably simple and remarkably affordable: regular nasal rinsing using a warm saline solution. A clinical review published in the journal Medicina surveyed evidence across a wide range of sinonasal conditions and concluded that nasal irrigation is an effective, safe, and low-cost strategy for treating and preventing upper respiratory tract diseases, and it is endorsed as a supportive treatment by ear, nose, and throat specialists internationally. High volume saline rinses work by physically removing inflammatory mucus, reducing mucosal swelling, and supporting the natural ciliary clearance function that declines with age. The single most important word in relation to this intervention is consistency. One or two uses produce 1 or 2 days of mild relief. Daily practice, applied correctly, produces cumulative and meaningful improvement over weeks. The exact method will be covered in the practical action plan. The third cause is where I see the most surprise on people's faces during clinical conversations. Because when we begin talking through what might be driving this symptom, the medications a person has been taking faithfully for months or years are simply not something they think to question. They are prescribed, they are trusted, they are doing their job, and yet they may be the direct cause of the throat symptom that has been bothering someone every single day. There is a class of blood pressure medications called ACE inhibitors, angiotensin converting enzyme inhibitors. These are prescribed millions of times annually worldwide. They are effective, they serve a genuinely important cardiovascular purpose, and they are well tolerated in most respects. But they carry a recognized class wide side effect that the research documents clearly and consistently. They allow a substance called bradykinin to accumulate in the body, and in a significant proportion of users, research reports between 5 and 20% of people taking this medication class that accumulation triggers persistent throat irritation and a continuous urge to clear the throat. Critically, this is not an allergic reaction. It is not something unusual or abnormal happening in the body. It is simply how the drug works pharmacologically, and the throat tissue is responding to the biochemical effect. The reason this connection gets missed so consistently is the timeline. This side effect can take weeks or months to develop after starting the medication. If you began a blood pressure prescription 8 months ago and your throat started bothering you about 6 months ago, you may never have drawn that connection. But that exact timing pattern is precisely what the research describes. A large scale study involving more than 27,000 patients found that adults over 65 had a 53% higher likelihood of experiencing this throat side effect compared to younger users of the same medications. This is specifically and disproportionately relevant to the age group I am addressing today. If you take a blood pressure medication and you are uncertain whether it belongs to this class, your pharmacist can tell you in under a minute. And if it does, there is an alternative medication category, ARBs, angiotensin receptor blockers, that controls blood pressure equally well and does not carry this specific throat side effect. That conversation with your prescribing physician is genuinely worth initiating. The fourth cause surprises people not because it is complicated, but because it feels too simple, too obvious, too easy to dismiss as something everyone already knows: hydration. But let me give you the physiology behind this, because it is not what most people assume. Your mucus is mostly water. Its consistency, whether it is thin, fluid, and easily cleared, or thick, sticky, and difficult to move, is directly determined by how well hydrated the surrounding tissues are. The clearest way I can illustrate this is to think of maple syrup poured from a fresh bottle versus maple syrup that has been sitting open on a counter overnight. Same substance, completely different behavior under gravity, temperature, and movement. Your mucus behaves in exactly the same way based on your hydration state throughout the day. Now, here is the specific aging related detail that elevates this beyond a simple reminder to drink water. Research has established clearly that the thirst mechanism becomes significantly less reliable as we age. A younger adult feels thirsty well before they become meaningfully dehydrated. The early warning signal is sensitive and prompt. In older adults, that early warning system is blunted substantially. You can be dehydrated enough to noticeably affect your mucus consistency and your daily comfort without feeling particularly thirsty at all. The internal signal that should be prompting you to drink simply does not arrive until dehydration is already meaningfully established. Waiting for thirst to prompt fluid intake means consistently operating behind the physiological curve. A mildly dehydrated state maintained day after day keeps mucus persistently thickened in ways that amplify every other cause on this list. When silent reflux produces mucus, and that mucus is also thick from inadequate hydration, the combined effect on daily comfort is considerably worse than either factor alone would produce. A practical fluid target referenced across clinical nutrition guidance is approximately 30 milliliters per kilogram of body weight daily from all sources. Water, herbal teas, clear soups, and water rich foods all contribute toward that target. But the behavioral key is deliberate, consistent intake distributed throughout the day, rather than attempting to catch up in the evening when you finally notice you are thirsty. The fifth cause is one that rarely appears in discussions of this topic, and I consider that a meaningful gap because for a significant proportion of older adults dealing with persistent throat mucus, the root of the problem is not located in the throat, not in the sinuses, and not in the stomach. It is in the gut. Your digestive tract and your respiratory system are connected through shared regulatory pathways running through both the immune system and the nervous system. The health of your gut microbiome, the trillions of bacteria inhabiting your intestines, directly influences how reactive and how inflamed your upper airways are. When the balance of the gut microbiome is disrupted, a state researchers call dysbiosis, it can activate immune responses that promote mucus overproduction in the airways, not because anything is physically wrong with the throat itself, but because the gut is generating inflammatory signals that the respiratory system responds to by producing more mucus as a protective measure. This connection, sometimes described as the gut lung axis, is an active and growing area of clinical research. Studies published in the American Journal of Respiratory and Critical Care Medicine and the Journal of Allergy and Clinical Immunology have confirmed that gut microbiome disruption can trigger immune responses that promote airway inflammation and the throat mucus production that accompanies it. What disrupts the gut microbiome in older adults specifically? Several factors that are extremely common in this age group. Prolonged antibiotic use, which eliminates beneficial bacteria alongside the target pathogens. Diets low in fiber and fermented foods, which provide the substrates that beneficial bacteria need to thrive. Chronic psychological stress, which has direct measurable effects on gut bacterial populations, and the natural changes in gut motility and digestive enzyme production that come with aging itself. This is the cause that explains why some people address their reflux, rinse their sinuses daily, stay well hydrated, and still find that something residual persists. If the gut lung axis is contributing to airway inflammation, no amount of throat focused intervention fully resolves it. The gut needs to be addressed directly. Now, let me tell you about the two causes that almost always operate together, because this is the combination I see more often than any other in clinical practice, and it is the combination that produces the most persistent and most frustrating cases of throat mucus in adults over 55. Silent reflux and postnasal drip. Silent reflux, as you now understand, produces thick protective mucus in the throat through the acid irritation mechanism. Postnasal drip adds additional mucus draining down the back of the throat from inflamed sinuses. Both reach the throat, both accumulate in the same location, both are made worse by the slowed mucociliary clearance that comes with aging. And here is the compounding element that makes this combination particularly difficult. The acid from silent reflux can directly irritate and inflame the nasal passages and sinus lining when it reaches high enough in the airway, which then increases sinus mucus production, which then adds to the postnasal drip, which then compounds the sensation of throat congestion beyond what either cause alone would produce. The two conditions feed each other. Reflux worsens sinus drainage. Sinus drainage adds to the mucus burden the throat is already managing from the reflux response. If you are dealing with thick morning mucus that then transitions to all day throat congestion, this dual mechanism is the most likely explanation for why the symptom never fully resolves, no matter what single intervention you try. Now, let us talk about what you can actually do, because information without action is just interesting conversation, and you deserve more than that. For silent reflux, the single most immediately actionable change is elevating the head of your bed by approximately 4 inches, not adding extra pillows, which tend to bend the neck rather than elevate the torso. Elevating the entire head end of the mattress using bed risers or a wedge under the mattress. This uses gravity to keep stomach acid where it belongs while you sleep, which is when the most significant reflux damage to throat tissue occurs. Do this tonight. Within 1 to 2 weeks of consistent positional change, many people notice a meaningful reduction in morning throat heaviness. Additionally, avoid eating within 3 hours of lying down. The stomach needs time to empty before you recline. Reducing dietary triggers in the evening specifically, which include fatty foods, acidic foods such as tomatoes and citrus, chocolate, caffeine, and alcohol, reduces the acid volume available to reflux during sleep. For postnasal drip from sinus inflammation, daily nasal saline irrigation is the most evidence supported intervention available without a prescription. A neti pot or a squeeze bottle with pharmaceutical grade saline solution used once daily, preferably in the morning before breakfast, physically clears inflammatory mucus from the sinus passages and reduces the drainage that reaches the back of your throat throughout the day. The key word is daily. The research supporting nasal irrigation is specifically about consistent daily practice, not occasional use when symptoms feel worse. For the medication related cause, the only definitive resolution is a conversation with your prescribing physician about whether you are taking an ACE inhibitor and whether an ARB would be a clinically appropriate alternative for your specific cardiovascular needs. Do not stop a blood pressure medication without guidance, but do ask the question directly and specifically at your next appointment. For hydration, the behavioral shift that produces the most consistent improvement is drinking a full glass of water before breakfast each morning, before any other fluid or food. This begins rehydration from the overnight period when no fluid has been consumed for 7 or 8 hours. Then distribute remaining fluid intake across the day at consistent intervals rather than relying on thirst. Herbal teas, particularly chamomile and ginger, contribute to hydration while also carrying anti inflammatory properties that may provide additional benefit for throat tissue and sinus membranes. For the gut lung axis cause, the most accessible starting point is dietary. Increasing daily fiber intake from vegetables, legumes, and whole grains feeds the beneficial bacteria that maintain microbiome balance. Adding 1 to 2 servings daily of fermented foods, plain unsweetened yogurt with live cultures, kefir, sauerkraut, or kimchi directly introduces beneficial bacterial populations to the gut. These are not dramatic or expensive interventions. They are consistent daily dietary shifts that, maintained over 4 to 6 weeks, produce measurable changes in microbiome composition that the research links to reduced airway inflammation. Let me also tell you what not to do because some of the most common responses to persistent throat mucus actively make the underlying causes worse. Do not use decongestant sprays containing oxymetazoline for more than 3 consecutive days. The rebound effect, called rhinitis medicamentosa, can produce worse nasal congestion and increased mucus drainage than the original problem. Do not take antihistamines daily as a long term strategy for postnasal drip without addressing the underlying sinus inflammation. Do not eat dairy products late in the evening if you have identified morning throat mucus as your primary symptom. Dairy does not directly produce mucus, but its fat content can slow gastric emptying and promote overnight reflux in people who are already prone to it. And do not ignore this symptom because it has been present for a long time. Duration is not evidence that something is benign. It is often evidence that the underlying cause has simply never been correctly identified. Here is the complete picture of what you now know that most people dealing with this symptom do not. Your aging mucociliary clearance system means any excess mucus production hits harder and lasts longer than it would in a younger adult. Silent reflux is the most commonly missed cause in this age group, and it operates without any chest symptoms. Postnasal drip from chronic sinus inflammation compounds the reflux problem when both are present simultaneously. ACE inhibitor blood pressure medications are a direct pharmaceutical cause that can be addressed through a single physician conversation. Chronic mild dehydration keeps mucus thick in ways that amplify every other cause. And gut microbiome disruption can generate inflammatory signals that drive airway mucus production from entirely outside the respiratory system. These 5 causes do not operate in isolation. They operate together. They feed each other. They accumulate over years in ways that make the symptom feel permanent when it is anything but. Every one of these causes is addressable. Every one of the action steps I have given you today is something you can begin implementing this week, many of them tonight. Your body has been trying to tell you something. It has been saying it in the only language it has available, which is the language of symptoms. And now you have been given the translation. Start tonight with the bed elevation if morning heaviness is your primary experience. Start tomorrow morning with the saline rinse. Bring your medication list to your next appointment and ask the specific question about ACE inhibitors. Drink a glass of water before anything else in the morning. Add 1 fermented food to your daily diet this week. Small, consistent changes applied to the correct underlying causes produce real, measurable resolution of symptoms that have been present for months or years. Not immediately, not dramatically, but reliably over the weeks of consistent practice that the research consistently shows is where the benefit actually lives. Your throat has been asking for your attention. Today, you gave it something better than lozenges and a suggestion to drink more water. You gave it an actual explanation and an actual plan.